Hello, my name is Dr. Dewan S. Raja. Today I will discuss about lumbar triangles. The superior and inferior lumbar triangles are anatomical landmarks in the lower back defined by the arrangement of certain muscles and fascia. These triangles are clinically significant as they represent areas of potential weakness in the abdominal wall and may be sites for lumbar hernias. We have two lumbar hernias. There is possibility of two lumbar hernias. One is superior lumbar triangle, Grenfell lace shaft triangle. Number two is the inferior lumbar triangle or Petit's triangle. Okay. So these are two triangles. These two areas may have herniation. So here is the inferior lumbar triangle, here bounded by the iliac crest below, above, and medially by the latissimus dorsi, above and laterally by the posterior border of the erector spinae. It is floored by the internal oblique. Roof is by skin superficial fascias. Here is this is the inferior lumbar triangle. This is the superior lumbar triangle bounded by the 12th rib below and medially by the lateral border of quadratus lumborum. So below and medially by the lateral border of quadratus lumborum, below and laterally bounded by this is another muscle. This is the internal oblique muscle. Okay. So we got here 12th rib, the quadratus lumborum, which forms the medial boundary. We are getting the lateral boundary by the internal oblique. So this is the superior lumbar triangle. Its floor is formed by the transversalis fascia and the aponeurosis of transversus abdominis. Roof is formed by the latissimus dorsi and partly by the external oblique and also over the subcutaneous tissue and the skin that forms the roof. So let's get the description. Superior lumbar triangle, Greenfeld lace shaft triangle, name of two physicians in two different time. They describe this. Boundaries above 12th rib, medial boundary by lateral border of quadratus lumborum, lateral boundary by posterior border of internal oblique muscle, floor by transversalis fascia and aponeurosis of transversus abdominis muscle. Clinical relevance. This is a site of lumbar hernia which may develop due to increased intra-abdominal pressure or muscle weakness in this area. Muscle weakness following a surgery, particularly kidney area surgery. There may be any type of trauma that may also lead to muscle weakness. Inferior lumbar triangle or Petit's triangle, bounded medially by lateral edge of the latissimus dorsimus, laterally posterior edge of the external oblique muscle, inferiorly by the iliac crest, floored by the internal oblique muscle. Okay, and roof is formed by the skin and subcutaneous tissue. Clinical relevance, a rare site of herniation, particularly in cases of weakened abdominal muscles or increased intra-abdominal pressure. So herniation is possible in both cases, but these are rare in comparison to that of inguinal hernias. Okay, this is a hernia in the superior lumbar triangle. Okay, this is the 12th rib here. This is the hernia in the space of Greenfield superior lumbar triangle here. Sometimes this type of hernia may be confused with that of lipoma. Here is another example of hernia. Hernia does not, it is not a common finding. Hernia is an abnormal protrusion. So we have triangle, but hernia is rare in both cases. Hernia, here is the inferior lumbar triangle. Okay, we got that. Latissimus dorsi internal oblique iliac crest, and this is the hernia in the triangle of Petit or inferior lumbar triangle. And that's all about the lumbar triangle. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.